So based on 2018 data, this is I've known this for a while, but this like every time I say this, it still just shocks me. 63% of American men are either diabetic, meaning type 2, full blown type 2s, or pre diabetic. So almost two-thirds of the population, okay, is either diabetic or pre diabetic. So let that sink in. Is it any surprise that these men are suffering from low testosterone? They are metabolic dumpster fires when they walk into the door of the TRT clinic. And it's not surprising that those are exactly the kind of men who, when they receive their first bolus of testosterone, are going to have a hard time. They are not metabolically prepared to turn the clock back, if it ever was turned back, to a testosterone level of say 1200. They cannot handle that, and they're going to experience all the side effects that we've talked about previously. It's a sign again of an inexperienced provider, in my opinion, that takes somebody like that and just like floods them with high doses of testosterone. And this is why many of these clinics, there's a reason they do 200 milligrams of testosterone cypionate and a milligram of anastrozole right out of the gate. Okay, this is the reason. This is the reason because they know that these guys are not going to be they are not prepared to handle the rocket fuel that they get, and they're going to get side effects. And so they offset that. I should say they put a band-aid on it. They stick the binky in the baby's mouth to quiet the baby and to cover up the symptoms that these men are experiencing. But they're really not doing them any favors in the long.